Hello, everyone. My name is Ivan Sanchez Diaz, and I am an associate professor at Chalmers University of Technology in Sweden. And today I'm going to talk about our research on assessing inequalities in access to online home delivery services and the way COVID-19 compounds marginalization. This study was co-authored by General Tuntal-Dural and Arnie Halldórsson, who are my colleagues here at Chalmers. The question that drove our research was if there are any inequalities in access to online delivery services. And you will find out the answer to this question at the end of the presentation. But as you know, the goal of any modern society, of any functioning society, is to ensure that everyone, irrespective of their attributes, has access to goods, to food, to drugs, to clothes. And that goal needs to be ensured by the governments. Now, with the rise of e-commerce, we have seen that that's a big opportunity. So this could be used as leverage so that everyone has easier access to those type of goods. But as e-commerce and as logistic services of e-commerce are governed by the rule of free market, that means that companies want to make money out of it. That's natural. But that also means that they will focus on high-income people, and they will focus on people that live in urban areas, because that means they could have economies of scope. They can deliver to more people that are closer in high-density areas. And that leads us to two key concepts in our research. One is marginalized population, which are populations that are not considered when designing these type of services. And the other concept is vulnerable population. So these are people that are more affected by crisis or in general because of their age or their health or other characteristics. So these are two key concepts. Now, with COVID-19, we saw that people that were vulnerable was often also marginalized. That means that people who could not leave home because they had some health issues or because they were old and they were more susceptible to major complications from COVID-19, they were also marginalized. They were also living in areas that were not served by many of these services. And that was our hypothesis that we wanted to test by collecting data. So basically this paper, what we did was to assess if that was true. If people who were marginalized from those services that had low access, basically, were also vulnerable. I mean, were old and were also susceptible of catching COVID-19 cases. And in order to do that, we collected three types of data. One was the access to online home delivery services. So we went to different companies that serve food, that deliver prescribed drugs, and that deliver all types of parcels. And we saw where they were delivering and where they were not. The second database is on demographics. So we looked at the age of the population, the income, race, also education level. And the third one was the number of COVID-19 cases. So how many COVID-19 cases were in different postcodes. And we studied that in the Västra Götaland region, which is a region here in Sweden. Our first findings are related to the access to online home delivery services. So what we found out is that about 40% of the people did not have access to prescribed drugs. So they could not get prescribed drugs at home. That is a big deal during a pandemic, because that means you have to go out and find a pharmacy and get the drugs. But also 50% of them could not get deliveries of food at home. And the average distance to a pickup point where they will get the parcels would be around 3 kilometers. And if you don't have public transportation or if you don't have a car, that means that it is about 45 minutes away. So basically this showed that not everyone had good access to home delivery services. Now, when we looked at how the overlay between clusters with low access to home deliveries and clusters of demographics that were more vulnerable looked like, we found out that there was some correlation. Something similar happened when we looked at the cases of COVID-19. We saw that there was some correlation and that clusters that actually had very low access to home delivery services often also had a high number of cases of COVID-19. which is the worst case scenario, because that means that there's a significant share of the population. We found out here 12% of all the population were living in postcodes that had a high number of COVID cases and also a low access to home delivery services. That means that they had to go out and pick up drugs in the pharmacy or go to the supermarket and get the risk of getting infected. So in terms of the conclusions, what we found out is that the access to home deliveries is not as high as we thought at the beginning. For a region that is very well developed in terms of logistics, the access is not as we thought at the beginning, although this has improved with the pandemic. We did a new data collection and we saw that for prescribed drugs, for example, this increased to almost 100% coverage. But before the pandemic, this was not the case. And we also found out that a lot of these inequalities were actually covered by ad hoc groups, so community groups that were working together in order to ensure that all the population or people sick could get the deliveries at home. So they were organized in Facebook or in other social media, and they will bring groceries to people that were in need of them and that could not go out. But in general, the key finding, and we have discussed this with some representatives of the public sector, is that there is a difference between what is written in terms of that everyone should get access to goods and what is the reality. Not everyone has access to goods in a safe and efficient way. So this is something that should be addressed by transport policy. And this was the key finding of our research. Now we are moving forward in making recommendations on how to ensure that it's not only the rule of market and the laws of market and of returns of investment, but there is also a social aspect related to the deliveries and to home delivery services. Thank you very much for your attention.